to start out with a new study that was recently released in the Journal of Pediatrics. And what it says is nearly 1 in 10 teens identify as gender diverse in this new study. So that's 10% we're looking at. So we went from what was, infinitesimally small number of people who had these identity issues 10 years ago to now 10% of the youth identifying as non-binary. And I feel like this is a huge issue, not so much again, because, kids like to push the boundaries. They like to, do their own thing, but because this identity of non-binary, of trans, of gender non-conforming now is putting these kids on a pathway towards medicalization. And so, if a kid wanted to come out and say, I'm non-binary, the pronouns kind of bug me, but it's not going to be harmful in the long run the way you would think, because of the surgeries that these kids are heading into and the hormones they're taking. And so it's, the declaration of non-binary now doesn't just mean I'm going to go by they, them pronouns and dress however I want and be gender non-conforming. And Alix, I don't know if you want to talk a little bit about it, because you've had more contact with these gender clinics and the kinds of the pathway these kids go on once they declare themselves as non-binary.
Yeah, well, the pathway is obviously not good, right? So let me just read you out a little bit about what they're now performing, which is a very strange procedure. So they're saying this is a hospital in California. Whilst many patients might be interested in transitioning into either a male or female identity, there are many individuals who feel that their gender identity does not quite conform in one direction. Gender nullification surgery can enable non-conforming patients to enjoy a relatively smooth genital area. Nullification creates a continuous and mostly unbroken transition from the abdomen down into the genital area. So like Barbie.
So like Barbie.
Or Ken.
Yeah, or like one of those dolls that I had that I fed her with a little bottle and she had a little pee hole at the bottom, but otherwise completely smooth. What on earth are we thinking? Like, how is this a good idea?
Yeah.
The other thing that I'm seeing over and over and over again is that girls who are coming out as non-binary feel the need to have their breasts cut off. It's incredibly confusing. Why is it if you're non-binary, would you need to change your body in any way whatsoever?
And what is it about breasts? What is it that is so problematic about breasts? I mean, I think we know any woman who has ever had a pair of them has had them ogled, has been catcalled. I mean, when we see this with younger and younger kids, I remember a friend of mine, a friend of hers, a man, said that her 4-year-old daughter had a cute ass.
Whoa.
Yeah, 4 years old. And this was probably 20 years ago. So, I mean, yeah, we know this happens. I'm not that surprised that young girls want to get rid of their breasts, because until you have a child, they're not functional. Until you have a sexual relationship, they're not something that you're really using for any purpose. But yet men still just can't help making comments about them, trying to touch them, whatever. It just sickens me that this is what's happening with young girls. We need to change men is what we need to do. We need to change the way men behave. We don't need young girls cutting their breasts off.
Well, and we also have to, I mean, for some reason, the whole narrative that it's possible to have a girl dick or a female penis has really caught on. But for these non-binary girls, you never hear, well, I'm identifying as more masculine, but I have larger breasts. In all honesty, there are a lot of men who have breasts larger than me. Does that mean that they are now non-binary, or that they should identify as women simply because they have more fat on their chest than I do? I mean, it's a very confusing narrative. And as you said, I think that it's being driven by these girls being really uncomfortable with the attention that they're getting as women, which is really heartbreaking. I also think there's something a little bit more insidious there, that this is being pushed on our society because people are making so much money. We are continuing to have celebrities come out and I'm non-binary, and everybody, oh my gosh, how authentic and brave and stunning you are, because you have decided to force society to use they, them pronouns, basically.
Also, I'd even go a step further and say that I'm not entirely sure that it's just about the way that the women are getting treated. I think that if you go into a school and you start telling them, you know what, you could be more authentic if you had different eyes. You know, you may have blue eyes, but you can identify as having brown eyes. You're going to have an increase of susceptible people like teenage girls who are going to start to want to have, you know, surgeries to change their eyes or whatever. So this is coming from the sex education, which internationally is run by IPP, International Planned Parenthood. Everywhere in the world, South Africa has IPP, sex education, gender identity education. You know, in the farthest corners of the world where they do not need this stuff, it's being pushed to them. And I really think that this is a medical identity. Non-binary is a medical declaration, a medical identity. And I'm incredibly concerned about what does that mean in practice? Does that mean that, I mean, I pray that it doesn't happen, but is Demi Lovato going to start taking cross-sex hormones? Is she going to have her breasts removed? You know, what does this really mean?
Yeah, it is. It's really disturbing to me. And one of the things that keeps running through my mind is that they're teaching these kids as young as kindergarten that they get to pick their gender. And in all honesty, I don't know a single child who would identify as a Barbie or a Ken. And so it's not surprising that we have all these people coming out and saying they're non-binary because, you know, there are very few people who really adhere, you know, 100% to the regressive stereotypes of what it means to be male or female. So basically, the message these children are getting from a very early age is that they're not male or female, they're non-binary, they're somewhere in between, because in fact, we all have characteristics of both sex, some more than others, but especially children tend to be pretty androgynous. So if you tell them to pick which gender they're going to be, I would bet, you know, darn near all of them are going to come out as non-binary. And if that's celebrated, and then they're told part of being non-binary means this medicalized pathway, well, my goodness, we now have, we're going to go from 10% of the population to probably close to 99 to 100% of the population identifying as non-binary and trying to access these medical services.
And I'm sorry, I mean, just to kind of go back to the medical services again. So, you know, we have these massive corporations, these juggernauts, these, you know, absolutely fierce corporations who are getting behind corporate pride. It's no mistake that the HRC has decided that, you know, they've really removed all of their, you know, so-called gay rights agenda because it's not worth any money anymore. Absolutely not worth any money whatsoever. They're now completely obsessed, really obsessed with non-binary identities. They're really pushing this idea. And this was unheard of 10 years ago, totally unheard of. Yes, you may argue that there were these individuals who were self-identified women or self-identified men, but there wasn't this whole, you know, this declaration and this system of corporations that are there to facilitate it. A skeptical individual might say that Demi Lovato's entire thing is staged. And involving some of these organizations.
I would suggest that this is probably going to be the new way that people boost their careers. Because, you know, nobody who's been trans identified and comes out and says, "Oh, it turns out, you know, I was wrong. That was silly. I'm actually one." Nobody appears on the, you know, on the front page of the New York Times for saying something like that. Nobody gets a, you know, huge number of social media likes for something like that. In fact, they're attacked and told to shut up and told they were never trans in the first place. But boy, if you come out and say you're a non-binary, all of a sudden people are celebrating. All of a sudden you're brave and authentic. You can talk about how tortured you've been, having to try and pretend to live as a woman or a man all your life when it turns out you're somewhere in between. And I just want to talk about the implications. If we have now 10% of youth identifying somewhere along, underneath the rainbow, the trans rainbow. So either transgender or non-binary or somewhere along that rainbow. I'm guessing the numbers are going to increasingly go up. What happens to the category of male and female when we have it being pushed against so much? When we have children being taught that they're somewhere in between, and that only those who self-identify as women are women and self-identify as men are men, we basically get rid of the category of man and woman as we have historically known it. And we are creating a brand new category, which is based solely on feelings rather than anything objective or empirical. What does that do to society?
It's so nonsensical. I mean, I can't even really like extrapolate out what that means on a sociological level, but it's so nonsensical. Everybody knows what a woman is. Everybody knows what a man is. I mean, I've heard people say this all over this ideology. No woman has ever escaped being raped by identifying out of womanhood. Oh, don't rape me, I'm not a woman. The rapist knows that you're a woman. And so all we're doing by agreeing with this and applauding this is just walking into deeper and deeper levels of deception and lying. We all know, I mean, most trans identified people do not pass as the opposite sex. Some can, most do not. It's just not tenable.
Yeah. Well, and when it's interesting, I heard, I think it was Donald Trump Jr. actually talking about how wonderful it would be if we got rid of sex-based spaces and bathrooms and locker rooms, and everything became gender neutral. It would save so much money for people who were, in the construction industry, who were making these buildings. Developers would save so much money because then they'd only have to have one bathroom facility for everybody rather than two separate ones. And so again, it's like a financial motivation here to push this. And as you mentioned, all of this marketing surrounding it. I'm thinking about people who are truly marginalized in our society, and they don't have shoes made for them. They don't have t-shirts with their logo all over it. I am just astonished. We just had a Kellogg's breakfast cereal come out, and on the label it says, to write your pronouns on it. This is really a nefarious agenda. I think it doesn't have to do with with trying to honor children or help them to be less discriminated against. We're indoctrinating children at the those kids who eat these breakfast cereals are maybe 2 or 3 and are going to be saying, what does this mean? What pronoun? It's really.
Well, the thing is, Erin, today it's the pronouns, right? Which we all understand. We get it. We know what the pronouns are. Okay, we can choose to go along with it, or we can choose to refuse it. I'm choosing to refuse it. But you know what we don't know about? We don't know about, most parents don't know, what does NB-phobic mean? What does cis scum mean? What does cis washing mean? These are all terms that you can find on the HRC website. So if you're if you're a parent to a 14-year-old and they're talking about NB-phobia and cis washing, then it's very important, to be able to say, actually, honey, what you're talking about does make a lot of sense. And to kind of to pull them out of it, but almost like the way that Scientology creates a language to keep outsiders out of it, this has created a whole system and a whole way of language to make sure that basically that the parents don't know what they're talking about.
Yeah, I think that's so important, that separation, because I can't tell you how many times I've heard people say to those of us who are fighting this agenda, well, you're just too old to understand. You just don't understand. You're too old to understand. So it's separating us with this wedge. And again, they create this language. So the kids can, the kids say something and the parents are like, what? Cis what? What are you talking about? And the kids just go, you're just too stupid, or oh, you're just too old, you just won't understand. So again, it's very cult-like. And Maria, I don't know if you want to address, this is very typical of what cults do.
Yeah, it
Mhm.
is. It is. This is what cults do. And frankly, this is what kids have always done. I mean, I remember the slogan. I'm not old enough to actually remember this. I read about the slogan back in the early 60s, don't trust anybody over 30.
Uh,
And
Mhm.
every generation, the kids, there's something that they do that they know, some cultural thing that separates them from their parents. And that's a normal, natural thing that kids do. But there's
Mhm.
never been a time that I know of where a whole generation has been put on a medical path via this cultural phenomenon. You know, we had kids who were
Mhm.
goth, and they were all black and white makeup, and they sort of looked like vampires. But as far as I know, they weren't
Mhm.
actually out there drinking blood. They weren't actually, you know, getting
they
fangs.
might have been taking safety pins and piercing their ears with it, or
Yeah.
piercing their nipples or something. Like
Yeah.
that's probably, but they did it at home. They did it with their friends. They didn't have it sort of approved by the healthcare system. Insurance wasn't paying for it. They weren't, it wasn't, it was something they did sort of on the sly.
Yeah, and this
Mhm.
this feature of adolescence has just been co-opted, as Alex said, by the corporations, by this politicized machine, that they've got an agenda. They're going to make money off of this, and they're selling out our kids by sucking them into this cultural phenomenon, which has really become a cult, and telling them, if your parents don't agree with this, your parents are wrong. I just read a story of a woman whose teenage daughter went out of state, certainly supported by somebody, went out of state to have her breasts cut off because in the state she went to, she could do it without her parents' approval. This is a teenager. And we know that in states like Oregon, they give kids at 13 full medical decision making for themselves. So these young kids, you know, are having their breasts cut off. I've never ever seen a whole cohort of kids which the society has assisted them in severing relationships with their parents for the purpose of profiteering, predating on these kids.
And damaging them so profoundly.
Mhm. This is the type of thing that, to be honest, pimps do. They take vulnerable people, they pick vulnerable girls, they take them away from their families, take them away from their protections. They build a whole system around them. Most women who are under the control of pimps will actually say, they won't even call them a pimp. They will call him daddy, or they will call him their boyfriend. And they say even that there are other women that they're under the same control of the pimp. They call them a wife. So, it's all very much the same. We're your glitter family. We are the ones that understand you, screw your parents. They don't get it. Like, and it feels very, very similar.
Yeah, and the fact that they keep upping the ante is also really disturbing.
Mhm.
It started out that maybe someone at 19 would take cross-sex hormones, and then maybe somebody who was 13 would take cross-sex hormones, and then they threw in the puberty blockers, and now puberty blockers plus the hormones. Well, now 13-year-olds are getting mastectomies, 15, 16-year-olds are getting their testicles cut off. And now we have this nullification where you can just get your genitalia removed so you look like a doll. And again, oftentimes insurance companies will pay for this as somehow medically necessary because the opposition has used the suicide myth in order to perpetrate the idea that these surgeries and these medical interventions are, life-saving. And I can't think of anything more absurd, in all honesty. It just absolutely infuriates me that they're pushing these children, if they hate their bodies so much they want their genitals completely removed so they look like a doll. That is someone who needs mental health services, serious mental health services. That is someone who wants to self-harm in a profound way. That is not someone who should be encouraged to pursue this and told, well, if you don't get the services you want, you can always, you probably will be suicidal, because that's how significant this is. If your parents don't support you getting your breasts cut cutoff, you should probably consider suicide because this is life-saving care that you have to have. The narrative is so damaging. And there's no other situation where mental health experts suggest that people acquiesce to suicide threats. And so, again, it's just so insidious.
Yeah, I was wondering that when have we ever learned that it's appropriate to give in to suicide threats? And it's particularly diabolical because these are children. And I mean, that's the worst thing a parent can imagine is their child committing suicide. And so the industry, the gender industry, is really preying on parents' fears and on children's vulnerabilities. But I had a boyfriend in college that I broke up with him, and he would call me in the middle of the night. Oh, I'm going to kill myself if you don't take me back. I'm going to kill myself. And I was 19 and I was stupid. And that went on for a couple of months before somebody told me, Maria, that's not your responsibility. That's completely inappropriate for him to do that to you. You have a right to say no to him.
Yeah.
But now if somebody threatens suicide, we're supposed to just let them self-harm to the degree that the pharmaceutical companies get the most money out of it.
Yeah. Yeah, there's something very wrong with it. In fact, I grew up with my brother was suicidal often, and I actually had therapists who would help me to understand that if he actually attempted and completed a suicide, it was completely and 100% not my fault. That it was something he was choosing to do, and that under no circumstances should I enable his behavior, because oftentimes he had a drug and an alcohol problem. And oftentimes he would come to me, he would ask me to hide his drugs or alcohol because he was going to try and quit. And then he'd come to me and say, I have to have them, I'm going to kill myself. And I would, it was a very unhealthy relationship that had been developing. And therapists were like, you've got to stop. And I was terrified he was going to kill himself. I was so scared. I lived with this constant threat that it would be my fault. And I really had to work through that. And again, therapists will say it's never your fault. There's nothing that you can do to make somebody kill themselves. That is a person's individual choice. And yet now we have this constant narrative that they use to get pretty much anything they want. Well, if I don't get to use the bathroom, I'll kill myself. Well, if I don't get the surgery, I'll kill myself. If you don't use my pronouns, I'll kill myself. This is an incredibly destructive and manipulative narrative.
So I would say if anybody is concerned about this, if you're concerned because you've heard the statistic, 10% of kids are identifying as non-binary, and you want to have some more information, come to Partners for Ethical Care. We run a 24/7 chat service to talk to you and to give you advice. Similarly, I've spoken to a lot of individuals who are coming from the education sector, from social work, and even from the ministry in the US, who have told me that they're basically being re-educated on this agenda. So if that's you, come to Partners for Ethical Care. We want to help. If you're a victim of surgeons, come to Partners for Ethical Care. We want to help. And if we can't help you specifically, us ourselves, we will put you in touch with resources.
And I also want to encourage people, if you have kids who are identified as transgender and you're just wondering what to do because this is so overwhelming, just encourage you to get Maria Keffler's book. It's just a great resource guide for parents who are struggling with this, and you can access that on our website as well. So again, just come to partnersforethicalcare.com, and if you come to the chat and for some reason one of us isn't available to chat at the moment, please send us an email and we'll get back to you as soon as we can.